In addition to patients' concern about their survival and long-term prognosis, I think patients are worried about their pain being controlled, their quality of life, what aspect of their life they're going to be able to continue. I always think it's really important to continue to do whatever you feel up to doing. Keep your life as normal as possible, as little disruption as possible. I think that's good for patients physically and psychologically. Fatigue is a very common symptom of metastatic breast cancer. Some of the therapies cause fatigue, and the cancer itself can cause fatigue. So exercise as much as possible is really important in helping to alleviate some of the side effects of medication. And being active tends to give people more energy, but sometimes medications are needed for fatigue as well. Palliative care specialists can help us with that. I think taking care of yourself is advocating for yourself at your doctor's visits. I think taking care of yourself is being able to ask other people for help, leaning on other people for support, seeking out social work help or psychologists or psychiatrists, educating yourself about the treatment options that are being offered to you. It's great to take care of patients who are really participating in their care. Support groups are helpful for some patients and really not helpful for other patients. Sometimes patients can find support groups very scary because the patient has a very different story and a different type of breast cancer. And why is that person getting different treatment from what I'm getting? So for some people, it can be really hard. Others find tremendous comfort in sharing with other patients with a similar diagnosis. There's so much scary stuff out there that I usually tell people if they're going to go online to go on a reputable website like the National Cancer Institute or the American Society of Clinical Oncology or some major academic medical centers sometimes have very good websites. I think the relationship with a medical oncologist for someone with metastatic breast cancer is really important, and it has to be a good fit. It has to be someone that you're really comfortable talking about your fears, whatever side effects that you might be uncomfortable talking about, to really share what's going on, what other alternative therapies you may be using, to find someone listening to you without judgment, who's able to support you, who's able to alleviate some of your anxieties. I think it has to be the right click. It has to be someone who's going to spend the time to answer every last question. Sometimes that means we run a little bit behind, but I think you have to give every single person the opportunity to get their questions answered and take the time to do that. Just be a really good listener.